Jai Hind everyone, welcome to my YouTube channel which is Explore Yourselves, Banking and General Knowledge, etc. Today I'm going to describe about brain stroke warning signs, early symptoms you should never ignore. Introduction. A brain stroke is one of the leading medical emergencies worldwide and requires immediate attention. It can happen without warning, but in many cases the body gives early signals that should never be overlooked. Recognizing these warning signs and seeking emergency medical care without delay can greatly improve survival rates and reduce the risk of permanent disability. Understanding the symptoms, risk factors, and preventive measures is essential for protecting yourself and your loved ones. What is a brain stroke? A brain stroke occurs when the blood supply to a part of the brain is interrupted and when a blood vessel in the brain ruptures. As a result, brain cells are deprived of oxygen and nutrients, causing them to become damaged or die within minutes. Since brain tissue cannot survive long without adequate blood flow, rapid diagnosis and treatment are critical to minimizing brain damage and improving recovery. Common types of stroke. There are three main types of stroke. Ischemic stroke, the most common type, caused by a blockage in an artery supplying blood to the brain. Hemorrhagic stroke occurs when a weakened blood vessel bursts, leading to the bleeding inside or around the brain. Transient ischemic attack, often called a mini stroke. It is caused by temporary interruption of blood flow, although symptoms usually resolve quickly. A TIA is a serious warning that major stroke may occur in the future. Major risk factors that increase stroke risk. Several medical conditions and lifestyle habits can significantly increase the likelihood of experiencing a stroke. Among them, high blood pressure, hypertension is the single most important and preventable risk factor as it damages blood vessels and increases the chances of blockage or rupture. Major risk factors that increase stroke risk. Other common factors include diabetes, high cholesterol, obesity or excess body weight, heart disease and irregular heartbeat such as atrial fibrillation, smoking and tobacco use, excessive alcohol consumption, physical inactivity, unhealthy diet high in saturated fats, salt and processed foods, increasing age, family history of stroke or cardiovascular diseases. People with one or more of these risk factors should go undergo regular health checkups and closely monitor their health. Early warning signs you should never ignore. A stroke often develops suddenly. If any of the following symptoms appear, seek emergency medical attention immediately. Sudden difficulty speaking or understanding. The affected person may slur in their speech, struggle to speak clearly, become unable to form sentences, or have difficulty understanding what others are saying. Facial drooping. One side of the face may droop or become numb. Ask the person to smile. If one side appears uneven or does not move normally, it may indicate a stroke. Weakness or numbness. Sudden weakness, numbness, or paralysis affecting the face, arm, or leg, especially on one side of the body, is a classic warning sign. The person may be unable to raise one arm or may lose balance while walking. Vision problems, blurred vision, double vision, or sudden loss of vision in one or both eyes may occur without warning. Loss of balance or coordination, sudden dizziness, difficulty walking, loss of coordination, or unexplained falls can also signal a stroke. Severe headache, a sudden intense headache, unlike any previously experienced, particularly when accompanied by vomiting, dizziness, or altered consciousness, may indicate a hemorrhagic stroke and requires immediate emergency care. Sudden confusion, the person may become confused, disoriented, or unable to follow simple instructions. Remember the FAST test. A simple way to recognize a possible stroke is the FAST method. F for face, ask the person to smile. Does one side of the face droop? A with for arms, ask them to raise both arms, thus one arm drift downwards. S for speech, ask them to repeat a simple sentence. Is the speech slurred or unusual? T for time, if you notice any of these signs, call emergency medical services immediately. Every minute counts. The importance of the golden hour. Stroke treatment is highly time sensitive. The first few hours after symptoms begin after often referred to as the golden period, during which rapid medical intervention offers the best chance of preserving brain function. For many ischemic strokes, clot dissolving treatment or other specialized procedures may be possible if the patient reaches the hospital quickly. Delaying treatment can lead to a permanent brain injury, paralysis, speech impairment, memory problems, disability, or even death. Never wait for symptoms to improve on their own. Immediate hospitalization can save brain tissue and improve long term recovery. How to reduce a stroke risk? Although not all strokes can be prevented, many are linked to controllable risk factors. You can lower your risk by keeping blood pressure under control, managing diabetes and cholesterol levels, eating a balanced diet rich in fruits, vegetables, whole grains, and lean proteins, exercising regularly for at least 150 minutes per week, maintaining a healthy body weight, avoiding smoking and tobacco products, limiting alcohol consumption, managing stress effectively, taking prescribed medications as directed, scheduling regular health screenings and medical checkups. Conclusion: a brain stroke is a life threatening emergency where every second matters. Learning to recognize and the earliest warning signs, understanding the risk factors, and acting immediately can significantly improve the chances of survival and recovery. Prompt medical treatment, along with a healthy lifestyle and regular health monitoring, remains the most effective strategy for reducing the burden of stroke and protecting the long term brain health. Disclaimer: this article is intended solely for educational and awareness purposes and should not be considered as a substitute for professional medical advice, diagnosis, or treatment. If you or someone around you experiences symptoms suggestive of a stroke, seek immediate emergency medical care immediately. Do not attempt to self diagnose or delay treatment, as early medical intervention can save lives and minimize permanent brain damage. Always consult a qualified healthcare professional or personalized medical guidance. Thank you very much for your patience. Please like and share this video and subscribe to my YouTube channel.